So what is blood pressure? Actually, it refers to the pressure of the column of blood which is exerted on the vessel walls. This is almost similar to the liquid column which exerts a pressure on a cylinder at the sides. So how do we record blood pressure? There are a number of non-invasive as well as the invasive methods. You would have been familiar with some common devices which we use. So one is the home monitoring device, which is an automated blood pressure monitor, which can be used conventional for the arm or the wrist one. We also have the mercury sphygmomanometers, which we use in the physician's office, as well as a 24-hour ambulatory blood pressure monitoring devices. There are also invasive methods wherein this is done in a monitored critical care unit setting, wherein is a small probe inserted into an artery at the wrist, which records the blood pressure directly. So blood pressure is measured in millimeter of mercury. The top reading is called what we say the systolic blood pressure. The bottom reading is the diastolic blood pressure. So what is the correct recording of the blood pressure? So before taking your reading, ensure that you do not have any food or drink for at least 30 minutes before. Empty your bladder, as full bladder sometimes can increase your readings. Then during the measurement itself, try to remain calm. Be seated in a comfortable posture, arm by the side of the body, arm at the level of the heart. Cuff should be at the bare skin, back should be supported, and this should be at the same level of the heart. So what are some of the normal variations in blood pressure? In general, the blood pressure in the legs is higher than in the arms. In the arm, the variation can be there between the right and the left side, but generally less than 20 millimeter of mercury. So why is the blood pressure higher in the legs? So this is because of the effect of the gravity. As you can see from this simple physics diagram, when there is a column of blood in a cylinder, the column of liquid exerts the highest pressure at the bottom than at the top. So certain other factors which can increase the blood pressure is immediately after an exercise or after a heavy meal or caffeinated drinks. Anxiety and stress can increase, or white coat effect, which is in the physician's office. In general, there are lower readings seen in sleep as well as in children. The seasonal variation of blood pressure is noted, wherein slightly higher readings are noted in the winters than in the summer. So a typical fluctuations of the blood pressure happen during the day, as you can see, is lowest immediately on waking up and after the patient goes to sleep. Then during the course of his activities, etc., the blood pressure does rise during the day. So these are some of the normal physiological responses we see during the day. What are some common errors in the blood pressure measurement? Of course, some factors like if the person is anxious post-meal or caffeine intake immediately post-exercise or improper body positioning can affect the blood pressure measurement. Most other common error for measurement is using an improper cuff size or the position of the cuff. You can see that there are numerous cuff sizes. This is the one in the middle which we use for the standard adult. Then those who are very obese may need to use a larger cuff. So in general, the cuff inside we have a bladder which inflates, and this is what which compresses the arteries to record the blood pressure. So we have to satisfy certain dimensions for the bladder to ensure that the reading is accurate. If it is an inappropriately sized bladder, then the reading tend to be either over or underestimated. Of course, again, a faulty device will lead to the error in blood pressure measurement. So now coming to the actual term as to what is hypertension. So whenever the blood pressure is elevated, we call as hypertension. This is beyond the acceptable physiological limits, and this is confirmed on at least 2 separate occasions and at least 1 to 4 weeks apart. So the World Hypertension Day, the motto was record your blood pressure, control it, and live longer. So what are the cutoff readings for hypertension? So gradually over the years, the reading for which people are diagnosed as hypertension is being more and more stringent and tightened. As you can see, some of the earlier days, we used to call hypertension as more than 140. And those below that were still within a pre-hypertension group. But on the other hand, in recent years, even the readings more than 130 are considered to fall under the hypertension category. This data is, of course, from the Western world. If you look at our own data from our local guidelines, we still diagnose as hypertension if the reading is more than 140, and anything less than that still is called as a high normal blood pressure. Of course, in this category, we do advise individuals to follow healthy lifestyle measures to reduce the risk from becoming a hypertensive in later years. So what are some other categories of hypertension? We have the white coat hypertension, which means the readings of the individuals are higher in the clinic setting, but they are normal at home. Masked hypertension. In this entirety, the readings are actually normal in the clinic, but higher in the home. How common is hypertension? So by 2010, it is one of the leading cause of cardiovascular disease globally, and 9.4 million deaths have occurred worldwide. From the data provided by MOH in 2010, the MOH survey, at least 1 in 4 adult Singaporeans have hypertension. So in terms of treatment of hypertension in our community, the treatment has become more effective over the years. So percentage of hypertensives with a good blood pressure control has, of course, improved over the years. So how do you diagnose hypertension? Most of the time is incidentally picked up, as rarely it causes any symptom. But sometimes in the setting of poorly controlled hypertension, people may have chest pain or short of breath feeling because the heart is pumping against an increased workload. They can have persistent headaches or dimness in their vision, or they can have nose bleeding. So why do I have hypertension next? Or what are the causes people have hypertension? More than 95% of the time, the cause is unknown, what we call as a primary cause or the primary hypertension, essential hypertension. Only less than 5% of the patients will have some underlying cause, which could be hormonal, kidney problems, any medications, or narrowed arteries in the kidney, or snoring in the sleep, what we call as a sleep apnea. How will a doctor evaluate hypertension? Once you visit a physician who has diagnosed you to have hypertension, they will take a history and perform a physical examination, record your height and weight, because obesity may be linked to high blood pressure. Some basic tests which we do is blood test looking at the kidney function, screening for diabetes, screening for cholesterol, and urine test looking at the urinary proteins. And a basic electrocardiogram is done to see whether there's any end organ damage to the heart. Following which, if there is any more abnormalities found, more tests will be ordered. And of course, this is followed by education and counseling. So do I need to be treated for hypertension? Well, hypertension, we can say, is a silent killer, because if untreated, because of the increased workload it gives in the different organ beds, it will lead to multi-organ damage gradually. So it can cause heart failure and heart attack, kidney damage, or peripheral arterial disease, which means pain in the lower limbs because the arteries in the legs are occluded. It can affect the eyes, what we call retinopathy. It can give rise to stroke. So as you can see here, when the blood pressure trend increases, which is in the diastolic pressure, the risk of stroke as well as the risk of heart attack, coronary heart disease increases incrementally. So what happens if, let's say, I control the blood pressure? Even by reducing the diastolic blood pressure by 5 to 6 mm of Hg, the stroke risk is reduced by about 30%. And the heart disease risk is reduced by more than 14%. If I reduce the top reading, the systolic blood pressure, by 12 millimeter of mercury, about 1 in 9 deaths can be prevented in people who already have a target organ damage. In people who are still healthy, still 1 in 11 deaths can be prevented. So let's look at the last part of the talk, which is some of the common myths. So I feel well generally, don't think I have hypertension. So hypertension is a silent disease. It is not diagnosed unless you check your blood pressure. And this brings an important concept of screening and staying healthy. I'm on medications for blood pressure. Of late, my control is worse. Will I need to check if my heart arteries are blocked? So, one thing is that the hypertension does increase the chances of having coronary artery disease. However, a worse blood pressure control on its own does not necessarily mean that the heart arteries are blocked. There could be several other reasons. You should seek the physician's advice who will assess you and decide if there are any other further investigations needed. I have frequent headaches. My blood pressure readings are high, but I don't think I need treatment because then my body will depend on it. A person who has had headache in the setting of a high blood pressure, which means he's symptomatic, actually needs early as well as urgent treatment. So certainly for this poorly controlled blood pressure, long-term medications may be needed, but that doesn't rule out that if the person can follow good healthy lifestyle and adequate diet practices, there's always room to reduce the medications in future. So clinic blood pressure readings are always reliable. Well, if a home blood pressure monitoring is done accurately, it is more reliable than one time off clinic blood pressure readings. With that, I end my talk here. Thank you very much.